Now, can you tell us a little bit about your specific concern that you've written to Sajid Javid about this morning?
Well, indeed, because we've got a punishing unfair tax rise on working people about to be imposed by Tory MPs for a social care cap, which, while limits the liabilities that some people will pay and only benefits 1 in 7, there'll be 6 in 7 people who don't benefit. People will still be faced with top-up charges and fees. People will still be forced to lose their home in certain circumstances, so it fails on its own terms. And when you look at the small print of the proposals, because of the way the financing works, or rather the lack of financing works, care homes are faced with going bust or council tax going up. Look, social care is a broken bust system in this country, but we don't believe that this cap on a broken bust system is going to fix social care in the way we need to see it fixed.
Okay, so you don't like the plan. I think we all got that message. Have you got one of your own?
Yes, we have. We've got an alternative approach. Look, part of the problem with social care is that 3,000 people a day are turned down for social care. There'll be Times readers and Times listeners who are struggling to get social care for their mum or their dad who's got dementia. Even though their GP says they need care, they battle with a complex system and the council turns them down. Not because the council are callous, but because the council doesn't have the funding and the eligibility criteria has narrowed. So we would expand social care to provide the tailored, personalised care that people need so they could stay in their home and not be put into a home. Secondly, we would drive up quality and standards, because at the moment you have these dehumanising 15 minutes flying visits where people take you out of bed and put you in bed, not when you want to be put to bed, but when the system tells you you have to go to bed. So we need to recruit more staff, to pay them more, a national living wage, invest in their training as well, and get rid of the 0 hours contracts. And thirdly, we've got to support carers in this country. Those are the people who care for their relatives, often have to leave the labour market as a result. They need better support and respite. So we do have an alternative approach to fixing social care. The cap on costs that Boris Johnson has proposed simply will not fix this broken system. There are more fundamental things that need to be done.
But Mr. Ashworth, no one's going to disagree with any of the things that you want to do there that would obviously give us a much better and far expanded and better paid social care system. But how on earth are you going to pay for all of that? Because the government's just increased taxes by £12 billion a year. What you've just set out would cost far more than that.
Well, for a start, the problem with the system, because it is so broken, means that the social care system responds to an individual at crisis points, when they need to go into a home or when they are trapped in a hospital bed. They're well enough to leave hospital, but there's nowhere for them to go. If you intervene earlier and provide that tailored, personalised care, you'll actually save money. The IPPR estimates you'll save £2.5 billion. So that is money that we will reallocate to the front line. There are other elements of the system where we're not spending money well. For example, let me just give you a very quick example. Adults with learning disabilities and autism are locked up in the most barbaric of circumstances at the moment. You hear stories of people with autism locked in cells with a foam mattress and their food put through a hatch. It's like something from the Victorian era. And it costs us £500 million. And for each individual, it costs, or the state pays, £200,000. If we had better facilities in the community, we don't need to be paying those amounts of money for a Victorian barbaric system. So we will deal with that. And the third point I want to make is that the way we raise money for social care is now across 7 different funding streams and is delivered by different mechanisms. Better care, continuing healthcare. It's a complex mess. We would bring health, the NHS and social care closer together, sweep away bureaucracy so that people get seamless care and somebody with dementia isn't bounced around the system, never knowing who they're speaking to, being pushed from pillar to post. It's bad for the patient, bad for the individual, but it's not a good way to spend money.
Okay,
So
but I didn't hear anything that would come close to funding the sort of social care plan that you wanted. Can I just ask you specifically, though, Mr. Ashworth? Would you said that the tax rise announced by the government was unfair. Would you reverse that tax rise?
Well, look, you're not going. You don't get a Health Secretary making budget announcements on the
So you can't commit to that.
Sunday radio shows. But what we have said is that when you look at the long-term trends, when we know that 170,000 people are going to have, more people will have dementia and need care over the next 10 years, when you know over the next 50 years we're going to have 500,000 more diagnoses of cancer, you clearly need a long-term plan for health and social care to raise money for that has to be done in a fair way, which is why we have said that we shouldn't be clobbering the same people again who are going to be clobbered with council tax rises, clobbered with the freeze in the personal allowance. Some of them are going to be clobbered because they're going to lose £20 a week from the universal credit. We should be looking at a fairer way to fund these policies by asking those with the broadest shoulders to pay more. So we would have a fairer taxation system instead.
Okay, let's move on to the winter ahead, and you'll have heard the Health Secretary Sajid Javid say today that the plan for vaccine passports is now not going ahead. Do you welcome that decision?
Well, we've always been sceptical about the vaccine passport plans. We've said that I said that you shouldn't need to show a vaccine passport to get into H&M or Next at the Highcross Centre in Leicester, for example. So we've always been sceptical, but we know that winter's going to be difficult. So the NHS are fearing the worst winter in living memory. We know we're going to have more flu, more other respiratory problems, norovirus. So we need to prepare our NHS for winter. The way you do that is by driving up vaccination in those pockets of the country where the vaccination levels are still not as high as possible. And if we get the green light, because it does have to be a clinical decision, if we get the green light on vaccinating adolescents and doing booster jabs, we need to roll that out as quickly as possible.
The other story around this morning is the government potentially getting rid of the PCR test for travellers, international travellers this autumn. Would you support that?
Look, there's a series of measures which Boris Johnson is going to come to the House of Commons and announce. We don't, given that we know that the vaccination rates, we need to go further in certain pockets, but given that we know that vaccination rates are what they are, I mean, we don't object or quibble with that. But obviously, look, I've got to look at the details of when it comes to Parliament. I've only seen what's been briefed to Sunday newspapers, which, as I'm sure you'll appreciate, we'll look at all the details when the relevant documents are published in Parliament.
Okay. In jollier news for your party, anyway, you seem to have finally squeaked ahead in the opinion polls after goodness knows how long behind. Are you celebrating in Shea Ashworth this weekend?
We're celebrating Shea Ashworth. I don't know about that. Look, opinion polls come and go. What we in the Labour Party are going to continue to do is to put out there our message about how we will fix social care, and I've given you proposals of an alternative approach to social care. We're going to continue to put out a message about how we will transform our health system to prevent more ill health, to keep people well, so that people don't need to get an operation because we're keeping them well in the first place. We would also look at the way in which targets are used in the NHS. Sajid Javid just said he's going to get rid of targets in the NHS. He's described them as nonsense. If you're waiting for cancer treatment, it's important that you get that urgent referral within 2 weeks or treatment within 2 months. I don't think that is nonsense. So we're going to continue to make the arguments with gusto, with passion, and with conviction. And opinion polls come and go.